Good morning, Dr. Apalata here. I received a question through the WhatsApp group regarding the laboratory interpretation of hepatitis B virus infection. I just decided to make this quick video to explain to you how to interpret hepatitis B virus result. But before that we go to the interpretation, I wanted to share with you the structure of the virus itself. This is hepatitis B virus. It is a partially double-stranded DNA virus. So you can see that one of the strand of the DNA virus is not complete. So that's what we call a partially double-stranded DNA virus. And it has three types of antigen. We have the S antigen, that is the surface antigen here. You can see surface antigens. That is the surface antigen. And inside we have what we call the co-antigen. That is C antigen or co-antigen. And very inside we have the envelope antigens. The envelope antigens. Now the E antigen, that's what we call E antigen or envelope antigen, S antigen or surface antigen, C antigen or co-antigen. Now the incubation period of the infection varies between 60 to 90 days. Now very quickly, how does the acute hepatitis B infection look like? So this is how the acute infection looks like. After 4 weeks following exposure, the surface antigen, hepatitis B surface antigen or S antigen will occur or will be visible in the blood, can be found in the blood after 4 weeks of exposure, and it will increase the level, the titer will increase, and after that it starts decreasing until 24 weeks. It means that the surface antigen during an acute hepatitis B infection lasts for 6 months. So you expect it to decrease after 24 weeks following exposure. If the surface antigen persists after 24 weeks, it becomes a chronic hepatitis B infection. Then, only 2 weeks after the rise of the surface antigen, the antibody anti-co-antigen will start increasing. And here we have the IgM. IgM, that is the first antibody to occur in the blood. That will be replaced later by IgG, but we have IgM anti-hepatitis B co-antigen will rise. Until then, it will decrease at 32 weeks following exposure. And we have the total antibody anti-co-antigen that will remain there. Now from 32 weeks, we expect the presence of antibody anti-surface antigen that will increase and that will then last there or remain in the blood. And we can have all this happening with or without the presence of E antigen. So E antigen is a marker of a high level infectiousness. It means that you have a virus that is actively replicating. So if you see a patient who has surface antigen positive and IgM anti-hepatitis B co-antigen positive, this is what we call acute hepatitis B infection. And in that case, if this patient has E antigen positive, it means that he is a highly infectious patient. I repeat that by summarizing here the diagnosis of acute hepatitis B infection. So what I'm saying is that the diagnosis of acute hepatitis B infection is made in the presence of a positive hepatitis B surface antigen, hepatitis B surface antigen positive, a negative antibody surface antigen because it's not yet there, and a positive antibody co-antigen, that is an IgM co-antigen positive, anti-hepatitis B surface antigen negative, and hepatitis B surface antigen positive. That is how you make the diagnosis of acute hepatitis B. Now, if in addition to that you have E antigen positive, it means that this patient has a high level infectiousness, so he can easily infect other people because he has a virus that is actively replicating. But if your surface antigen persists beyond 6 months, beyond 24 weeks, and the antibody surface antigen is still negative, and the IgG, we have now the presence of IgG co-antigen, so this is what we call a chronic hepatitis B infection. So chronic hepatitis B infection is when you have surface antigen that persists above 24 weeks, and you have a negative antibody anti-surface antigen, and you have an IgG anti-co-antigen present. Other patients can recover from the infection. They can naturally recover from the infection. You will see that the surface antigen will become negative, and you will see the presence of antibody anti-surface antigen present in the blood, and you have IgG anti-hepatitis B co-antigen. So this is the diagnosis of recovery from the infection. Now, if you want to know if someone is only vaccinated, like what we see in the blood of many healthcare workers, to know that they are just vaccinated, you will see that the surface antigen is negative, the anti-surface antigen is positive, and the anti-co-antigen is negative. It means that it's a marker of vaccination. You can contact me if you want more details or to discuss further on 082 500 9728. Thank you.